even though you're taking thyroid medication, right? Apple, never been documented. Yes. Emma, yes. Okay. You see how many people here are taking thyroid medication and you're still having symptoms. Now, shouldn't the medication fix your symptoms? Well, I would say yes, typically that is the goal, but for 90% of you, unfortunately, that's not going to happen because you have a condition called Hashimoto's disease, and your medication that you're taking, unfortunately, is not going to do anything for Hashimoto's disease. In fact, the levothyroxine or medication you're taking is actually doing nothing for your thyroid either. You do have to get to the root cause of what is driving your thyroid problem. Okay. What is the best thing for Hashimoto's disease? There isn't a medication for Hashimoto's disease. Now, when your Hashimoto's disease causes hypothyroid, and now you will need some type of a thyroid medication at that point until you can either fix what's going on or you're going to be on it for a lifetime. Okay? It just depends. Now, a third of our patients can actually come off their thyroid medication. Now, we don't take them off; their prescribing physician takes them off. Okay. Cushing's. Okay, so you have an overactive adrenal gland. Okay. Angel, my Hashimoto's is causing autoimmune gastritis. What should I do? Okay, well, now I'm here to say that your gastritis is not only from probably the autoimmunity, that's the trigger, right? There's a lot you can do with gastritis, there's a lot you can do with Hashimoto's disease. Now, the thing that you have to keep in mind when you're looking at an autoimmune condition is our typical patient has 8 to 10 different triggers that's triggering your immune system to attack. 8 to 10. Okay. Now the thing is which one do you have? All of you are different. And many of you are going to ask me, well, how do you treat Hashimoto's disease? Well, you do have to find out what's firing off your immune system. Okay. It can be blood sugar problems. It can be adrenal dysfunction. It can be liver issues. It can be toxins. It can be viruses, infections. It can be leaky gut. It can be hormone imbalances. It can be food sensitivities. The list goes on. The key is you have to find out what yours are. None of you are the same. None of you are the same. Okay. I'm going to walk you through here really quick about how your thyroid actually works and what you can actually do about it and what type of nutrients. I don't think you guys can even see that. I don't believe you can even see that. Let's see here. Okay, dokie. Let's get some brown in there. Nutrients. Jeez. 1, 2, 3, 4, 5 nutrients we're going to talk about. Okay. All right. So let's do this. What we're going to do is I'm going to go through a couple of questions. I'm going to talk about exactly what we need to do with your thyroid and how that works. And we're going to break it all down for you. Don't miss it. Go ahead and like and follow for us. Let's go through a couple of questions here. Can you normalize thyroid values but still have thyroid issues? Absolutely. What I think you're asking is, can you have normal lab testing and still have symptoms? Yes. Now, the reason why this is because most of the time, I'm going to write over here labs. Labs, okay? Most doctors pull a TSH and maybe a free T4, right? That's it. You can't even see that, can you? You can't even see it. Wow, that's barely on there. Okay, so most of the time, let me do this. Let me just shoot this up. That's causing more problems than it's. There we go. Okay, so labs. You got a TSH and a free T4. Most of the time, that's all that your physicians are looking at to determine if you have a hypothyroid and if you need thyroid medication. That's really the key. Okay, only these two, but there's about 9 to 10 different markers you actually do need, and I'll walk you through those here in a second. Okay. You cannot turn off the fact that your body's attacking your thyroid. Yeah, so what your SW, what I think what she's saying is you cannot turn off. What you can do is you can't cure it. So once your body has determined that your thyroid is like a virus, right? It wants to attack it. You can't cure that. It's always going to have that affinity. What you can do, however, is you can put it into remission. You have it, but you don't have symptoms of it, you don't actively have an attack going on, you definitely can put it into remission. There's no question about that. Now, you cannot put it into remission if your only intervention is going to be taking thyroid medication. Okay. That's not going to do it. Now, that's not to say that you don't need thyroid medication. What that means is the thyroid medication is preventing you to have a medical emergency, but it's not doing anything about your thyroid autoimmunity. It's not doing anything for your thyroid. And so this attack continues until you find out what's driving this whole thing. And really, when you develop, there's two camps. And maybe I'll talk about it right now. Is there's Hashimoto's disease where your immune system is attacking your thyroid gland, and then there's hypothyroid, which is the effect from the Hashimoto's disease. So Hashimoto's causes low thyroid. That's the difference between the two. So you can have positive antibodies and not have a low thyroid situation. Not yet. 50% of all people that have positive antibodies will develop full-blown hypothyroid within 5 years. Okay. So it's only a matter of time. Okay. So yeah, you need to keep that in mind. Okay, I think we still have A1. Let's see here. Let me back up. What type of doctor should I see to figure out what is triggering the autoimmune gastritis? Okay, usually you're going to go to your gastroenterologist. You might also get you a rheumatologist involved. Those are the two basic ones. Now, here's what I'll tell you. They're going to give you a couple medications and you're on your way. Neither one of them are really going to get to the root of why you need to, why your immune system is triggering your immune system to attack. Okay, it doesn't mean you don't need to see them. But yes, I mean, I own a medical integrated clinic. We have the best of traditional medicine. We take the best of natural medicine, combine the two. But yeah, you're going to have to look outside of your little box there, probably, if you're looking to want to get full resolution. Okay. Um, your thyroid's 22 at goiter. Well, you definitely need to be evaluated. That's where conventional medicine comes in. Make sure you're not getting too much iodine. Let's find out why. Is that Hashimoto's is causing some of that? Usually it's not enough iodine. But get checked. Once you get it checked and find out what that is, then you may have to look outside the box. Okay. Zurich, you had a partial thyroidectomy. You've had horrible symptoms ever since. Okay, so what that means, if you've had your thyroidectomy where they've surgically removed your thyroid, or you've had an RAI, radioactive iodine, that basically destroys those cells. Now, the thing you need to keep in mind is when you take your thyroid medication, it should take all your symptoms away. If you still have symptoms, even though you don't have a thyroid, then there's something else going on. Okay, there's something else going on, right? And not only that, is you still have some thyroid tissue left over. You still have some thyroid tissue left over. Okay. Does thyroid issues cause brain zap? Yeah, it does. Is it normal to have these crazy heart palpitations, feel like burning up my leg? Pain has been bad. I'd say no, that's not normal, Candy. Now, what's going on? That I don't have enough information from this. Okay, sounds like it may not even be thyroid related. Uh, hi, nope, still tired. Okay, yeah. So you need to find out what's going on. That's what I do. Is I help people figure out what that is. Hi, I have high antibodies but normal thyroid levels. What can I do to help? Okay, listen. When you are told you have normal thyroid levels, what they mean is you don't have a hypothyroid. They checked these two markers, TSH and free T4. That's it. That's it. Doesn't mean you don't have a thyroid problem. It just means you didn't check these. But what was your free T3? What was your reverse T3? What was your T3 uptake? Okay, what was your total T4? What was your total T3? Okay, yeah, it's a lot more markers than just these two. Now, conventional medicine only needs these two because that's all they need to know if you need thyroid hormone. Listen, 90% of the people that I work with are taking thyroid medication already, and they feel like crap. Anyone like that in here? Are you taking thyroid medication and you still have, symptoms, fatigue, brain fog, weight gain? If you do, give me a thumbs up. Okay. Give me a yep, that's me because this is the problem. Once they prescribe that medication to you, they are done. That is the standard of care. That's all you're gonna get. So going from one primary care to another one or one endocrinologist to another one isn't gonna make any difference. They're following the same guidelines. What I do is really help the people that are taking the thyroid medication that they're still having symptoms, because conventional medicine is done. They're not gonna do anything else for you. We are an extension of that. Okay, let's look into what they're not going to look into. This is what we do with people. You can get your life back. Listen, I do these kind of I treat complex chronic patients. I've been doing it for 24 years. I've literally seen over 8,500 people, okay? Now here's the thing, one of my first patients was my wife, okay? She was struggling with multiple chronic illnesses, and she was going from doctor to doctor and literally getting no progress, only more medication. They wanted to do surgery, and she literally leaned over one night and she said, "Hey, listen, you need to figure out what's wrong. I'm going to all these doctors. It's not working. I need to find out what's wrong with me. I don't want a Band-Aid. I don't want to take a medication to cover my symptoms up. I want a fix. You need to figure it out." And I'm laying in bed going, "What? Okay." And so at that point is when I went on a journey to help my wife with her problems. Listen, I spent over $200,000. I flew all over the country. In fact, I was gone so much, one of my kids literally, I was driving the car with one of my kids, and one of my kids actually said to me, "Hey, dad, I'm a little uncomfortable around you now." I go, "Really? Why? Why would you be uncomfortable?" He goes, "'Cause you're gone all the time." So I made some significant sacrifices to try to help my wife. The good news is we found out how to help her. She's feeling amazing. She got her life back. And I still remember the day she told me that. Oh my gosh, I still remember the first time I feel amazing. Okay, in 5 years, she hasn't felt that way. And I still had an impression that, it wasn't, I felt like God or the universe, however you wanna say it, guided me to the solution. Okay. And I had a strong impression that it wasn't just for my wife, it was for other people. That's why I do these kind of cases for those people that are stuck where she was stuck. Nobody's helping her. Nobody's listening to you. They're gaslighting you. Well, there is hope. Listen, if you're sick and tired of being sick and tired, and you want to see if you're a candidate for us to work with you, because we don't work with everybody, is you can go to my TikTok bio and go right under where it just says more information. And you can actually do a free discovery call with me. I'll talk to you for a few minutes to make sure you're in the right place. Okay. Or if you're like, man, I'm ready to go. I'm ready for some lab tests. Okay. If you're there, you can do our special 179. You get $3,500 worth of lab testing plus an hour consultation via Zoom remotely. You don't have to come to Utah, all for 179. I don't know how long I'm going to do that, but feel free to go to the TikTok bio. If you don't know how to do it and you're watching this, you click this picture. The next picture that pops up in the box, click that. You're at my bio, and you can go right under where it says more info. Okay. All right. Let's see here. Let's go to the board real quick. All right. Here's the thing. Let me walk you through how your thyroid works real quick. Number one, your thyroid. All right. Now, your brain tells your thyroid what to do by using a hormone called TSH. Okay. Thyroid stimulating hormone comes to your thyroid gland and tells your thyroid to make thyroid hormone. Okay. TSH. And then the thyroid makes two hormones, T4 and T3 here. Okay. Now, T4, T3, let me zoom in a little bit so it gets a little, okay. So 80% of the hormone that's actually produced by your thyroid is T4, and only 20% is T3. Anyone here watching this know the difference between T4 and T3? Anybody know? And do you know why you have T4 and T3? There is a specific reason for that. Okay. One of these hormones are active hormones, and one of these hormones are an inactive hormone. Put in the comments which one do you think it is? Which one is the active one? Because thyroid hormone turns on every single cell of your body, every cell. Okay. Every single cell. Which one of these does it? Is it T4, T3? Okay. Sarah's guessing T4 is the active one. Okay. Now I'll give you a hint. The medication that you're taking, if you're taking levothyroxine, Synthroid, Levoxyl, um, okay, those are T4. Tyrosine, those are T4 hormones. So thyroid hormone that you're taking is almost always a synthetic T4. So which one of these are active or inactive? Well, let me tell you. inactive, active. Okay. T4 is inactive. It doesn't turn on any cells, only T3. Now, you may be asking yourself, well, why the heck does the body make so much inactive hormone? Let me explain it to you. This is why. Because much like you, if you're at home, you have cans of soup in your pantry. Now, why do you have kind of ready to go food in your pantry? Well, because sometimes, you know what, you're tired and you don't want to make, your dinner from scratch. You want to just go in there, get a can opener, and get the food out, pop it in the microwave. You got it in 2, 3 minutes, right? Versus if you make it from scratch, it takes forever. Think of your T4 as like a can of soup. T3 is the food that's inside of the can of soup. That's the stuff that you want, right? And what happens for many of you out here, what's happening is you are having a problem with what's called conversion, your ability to convert T4 into T3. Okay. So it's like you don't have a can opener. So it doesn't matter how much T4, it doesn't necessarily matter how many cans of soup you have in your pantry. If you don't have a can opener, guess what? You're getting no food. Okay, so many of you have symptoms, fatigue, weight gain, brain fog, your hair is thinning or falling out, dry skin, brittle nails, depression, anxiety, GI problems. Why? Because your body isn't efficiently converting 4 into 3. Now, here's a key point. The conversion process does not happen in your thyroid gland. It happens somewhere else. Okay. Well, where does it happen? Where do you guys think that this conversion of 4 into 3 take place? Put in the comments, where you think this conversion takes place. There's kind of 2 main areas where the conversion takes place, okay? Wednesday's saying liver, yellow queen liver, we got Gina liver and gut, we got a lot of liver, brain, okay? T4, am I still in here? Yeah. So T4 gets a ride on this truck. This truck is called the thyroid binding globulin truck. Okay. This truck delivers T4 to be converted in the conversion site where liver is the first stop. Okay. Your liver. And here's what happens. Okay. 60% of the T4 in the liver get turned into T3. That is the active hormone that's turning on your cells. But remember, only 60% of the T4 is doing that. Okay. 20% T4 gets turned into reverse T3. Anyone here have ever heard of reverse T3 before? Okay. Reverse T3 is a inactive hormone. It won't turn on any cells. Okay. It's really like the brakes to your thyroid hormone. It literally will block the receptors. Okay. It'll block the receptors of the thyroid hormone. Okay. And so think of reverse T3 as a check valve that prevents your body from over converting too much T3. Okay. So if you pull the T3, what happens with some of you is you're converting too much reverse T3 instead of the active stuff. And then you have thyroid symptoms. Okay. Then the rest of this 20% gets turned, this T4 into T3S and T3AC. Anyone ever heard of T3S and T3AC? Okay, right in here. These are inactive hormones. Okay, they won't turn on any cells either, at least not yet. There is one more step that these two can go through to be converted into the active hormone. Well, where's the next step? Well, I can tell you where it's not. It is not your liver. So here's what happens. You have a truck here. What's the name of the truck? You guys know the name? The same name as that one, thyroid binding globulin truck or thyroxine binding globulin truck, right? Where does it take it? Over to your gut. If your gut is healthy, if your gut is healthy, all right, you have enzymes called intestinal sulfatase enzymes that S and AC kick out T3. Now you get active T3 hormone. So here's my whole point. So let me ask you a question. Let's say you have a gut problem, which many of you do. Okay. Because you have the gut problem, you're not efficiently converting 20% of the hormone that you should get. Do you think that you losing 20% of conversion could give you thyroid symptoms like fatigue, weight gain, brain fog? Give me yes or a thumbs up in the comments. Okay. You having a gut problem makes it so you don't convert 20% of your hormone. Could that give you thyroid symptoms? Yes, it absolutely can give you thyroid symptoms. Now, here's the follow-up question. Is it a thyroid problem? All the way up here. Is it a thyroid problem that the gut isn't converting? Yes or no? No, it's not a thyroid problem. The thyroid symptoms are coming from where? Put in the comments where it's coming from. Well, YOLO queen, I love you. Okay, right. We had a question about if you sign up for the lab tests. Okay, you will go to your local LabCorp draw station there in your state. You need to be in the in the US to take advantage of that 179 special. Just go to your local LabCorp. We'll send you the lab order. We'll email you the lab order. Okay. So it's not a thyroid problem. It is a gut problem giving you thyroid symptoms. Okay, here's another question. What if your liver, let's say you have fatty liver, okay, and your fatty liver, you're not converting T4 appropriately into T3. Okay, could that give you thyroid symptoms? Yes. Is it a thyroid problem? No. What is it? It's a liver problem. So you see, this is my whole point with this is everybody is staring at your thyroid gland, looking at your thyroid gland, looking at these two markers only. And if these two are out of range, you get thyroid medication. If these two are normal, you don't get thyroid medication. And that is the extent. Who here, has really heard about your gut and your liver and these conversions that need to take place? And this is only this much of how your thyroid works. Okay. Okay. And that's the whole point. If you have hypothyroid, that's thyroid medication time. Okay. If you have hypothyroid, you're taking thyroid medication and you're still having symptoms, well, guess what? There's something else in the system that's not working. That's the point. And unfortunately, conventional medicine doesn't look deeper other than thyroid medication. So remember, the thyroid medication that you take most likely is going to be a synthetic T4 medication, synthroid, levothyroxine, Suboxone, tyrosine. Okay, T4. What do we know about T4, folks? T4 is inactive messenger on your cells. You swallow that pill an hour before you eat in the morning, what happens? It has to go through this whole process. Okay? It just doesn't instantly activate your cells. It has to go through the process. So if your gut's not working, you can have problems. Your liver not working, it could have problems. What if these enzymes aren't working in here? Okay? These enzymes are called deadenase enzymes. These need oxygen, they need iron, they need dopamine, they need MTHFR support. All of these to work right. And not only that, and more importantly, these are selenium dependent. So if you ever heard that you need to take selenium when you have Hashimoto's disease, you will most commonly hear that the reason why you need selenium is to support these enzyme processes. Okay? However, that's only one thing here. Okay. In fact, in your actual thyroid gland, I'll walk you through about hydrogen peroxide, but there's another process in your thyroid that requires selenium for you to make glutathione to deactivate the actual thing that's destroying your cells. Okay, so that's the whole thing. So wait, so let's say you have thyroid symptoms. Step one, you have thyroid symptoms. This is the life of a thyroid patient. The fatigue and weight gain and brain fog. You deal with it for a while, right? Until you're like, there's something wrong. I don't feel like it. So what do? Okay, now you're gonna go to your doctor. That's what most people do, right? Go to your doctor and go, "Hey, you know what? I'm struggling. I have these issues." And they're like, "Hey, you know what? Maybe it's a thyroid problem. Let's take a look at it." And so what do? They pull TSH, usually only TSH. In fact, the guidelines indicate only TSH is usually pulled, and if that's out of range, then you can pull additional tests. But you'll get a TSH, maybe a free T4. So let's say they check it, and these are out of range, okay? Which usually your TSH is gonna be high, and this is gonna be low for a hypothyroid, okay? And they go, "Guess what, Missy? We know what's wrong, okay? What you have is you have hypothyroid. Okay, you have hypothyroid, your thyroid isn't making enough hormone, okay, thyroid hormone. So what we're gonna need to do is we're gonna need to give you a prescription. Okay? And what do they give you? Prescription of levothyroxine of some form. And you're like, all right, this is great. I'm gonna take this levothyroxine. I'm gonna have energy again. I'm gonna lose all my weight. I'm not gonna be depressed anymore. This is awesome. Take the medication. They go back and check it. Months down later, you're still taking the medication as they tell you to take it. And you go back to your doctor and you to redo your blood and look, everything looks good. So what did they give you? What is levothyroxine? It's T4. You just had low T4. They're just replacing your T4. Okay. And you go, man, I'm still having symptoms. I still have fatigue. I still have brain fog. I still have all these same symptoms. And what happens to many of you? Oh, it's all in your head. Ah, you're just getting old. Hey, you got kids. Like, I'd be tired if I had to deal with kids all day. It's just 'cause you have kids. Give me a thumbs up if this sounds familiar, okay? Or, you're just perimenopausal. You're going through the change of life. Or my favorite, you're just getting old. Really? And so many of you are going and you're complaining, but here's the thing, and it's not like, conventional medicine isn't interested, but just keep in mind, the only thing when it comes to your thyroid, they're doing it. This is the guideline. The standard of care is levothyroxine. That's it. Once they given that to you, that's it. And you're like, "Well, isn't there something more?" They'll say, "Nope, there's nothing more." Although, what about all the stuff, right? What about all the stuff? They don't have time to go into it, and besides, the recommendation is levothyroxine, that's it. This is why I get this all the time. I have people that say, "Hey, I wanna go to a different endocrinologist, and maybe they'll pull additional labs or they'll look deeper." No, they won't. They're following the same American Thyroid Association guidelines. Same, the same guidebook. So the sooner you realize that once you've got the medication, you're done. Conventional medicine is done with you. It's hard to hear, but I just say that because unfortunately, changing doctors, and this is what I tell my patients, you even if you come to a clinic or my medical staff can prescribe you thyroid hormone, but we don't. If you're or we don't take it over, we refer you back to your doctor, right? They're the ones that put you on, they're the ones that take you off. Okay, but you have to realize once you get that medication, you're still having symptoms, they're done. You need to look outside of the conventional medicine box because there is nothing there for you. So if you like your endocrinologist, you like your primary care, stick with them. Don't move because you're just moving for just to move. You're gonna waste hours and money. You need to do something different. This is where we come in. I have a practice for over 24 years, helped over 8,500 of you that are struggling, and you think of me as like an extension. We are not here to replace your endocrinologist because you need someone to manage the medication. Now, even though a third of our patients can come off of the thyroid medication, we don't take them off. Your prescribing physician takes you off. And it is so easy to have them take you off. You know how you do it? There's only one way that you can get your doctor to take you off the medication, okay? Now, and this even goes for the doctor that told you, "You know what? You're gonna be on this for the rest of your life." I know you guys have been told that, and many of you, that will be the case. But if you're on medication, wouldn't you rather feel amazing on the medication? 'Cause all that we do is making sure that this whole process is working right. That is all it is, so your body can use the medication, right? So even those doctors say, "Hey, you're gonna be on for the rest of your life," they'll take you off too. It's simple. Prove to them with your blood work that you don't need it, that they're overprescribing. All you have to do. In fact, you don't have to say a word. You just go in there, let them do your blood work. If your TSH starts going too low and your free T4 goes too high, they will back you off, and they'll slowly back you off until they go, "Gosh, you know what? I don't understand it. Looks like you don't need this medication anymore. Let's give it a try." That's how it goes. It's simple, okay? Now, for some of you, you've waited too long. You have too much damage from Hashimoto's disease that you will need to be on a certain amount of medication, okay? Now, here's the thing. You're taking T4. Is T4 active? No, your body has to activate it. If your body cannot activate the hormone that you're taking, who cares if your labs change, right? You need to be able to get it into your cells so your cells can use it, okay? Okay, listen, if you're struggling and you need some help, you're ready to make a change, my suggestion to you is to reach out to us. We help people all over the world to help them through this process, okay? Now, if there's 2 ways, there's more, but basically 2. 1, you can do a free discovery call with us. Talk to us, 10, 15 minutes. Just says, let's just make sure you're in the right place. And you can do that in my bio and TikTok. You can schedule that, you pick your time and everything. If you're sitting there going, "You know what? I'm sick and tired of this," kinda like my wife was, she's sick and tired. You're ready to, like, do some lab testing? Great. Then you can go to, my TikTok profile and go where it says more information, and you can actually schedule our special we're running for $3,500 worth of lab tests, plus an hour-long consultation through Zoom with me for 179 bucks. Literally a no-brainer, okay? But only do either one of those if you're ready to take action, okay? You're ready to take action. You can DM us if you wanna shoot us a DM. My staff will get back with you, and they'll help you out, okay? Alright, let's go to some questions here. I'm gonna go to the most recent ones, guys, and we'll go from there. Let's see here. Tracy, Craig, yes. Listen, what I would suggest if you wanna work with us, Tracy, she's asking, "Can you be our doctor in Sherwood, Arkansas?" Yeah, I help people all over the world, okay, all over the world. So you don't have to be here in Utah, we do it remotely. So reach out to us for struggling, and we can help you with it. Sarah, how does it work when I have hypothyroidism, but I've never had symptoms? Okay, so you're one of the rare ones, Sarah, which means most likely you're taking thyroid medication. And literally, Sarah, that's all you have to do, okay? You don't need me, you don't need functional medicine, you just need to live a healthy lifestyle, and you're good to go. That's literally all you're gonna have to do. Unfortunately, Sarah, you're a rarity when it comes to hypothyroid. Only 5, maybe 10% of people are what they call primary hypothyroidism, and all you have to do is take the medication. There are people that take the medication that their symptoms go away, but 90% of them don't. That's the uh, Deborah's on 25 years, you're on NP thyroid. Okay. Hopefully you're feeling better. If not, reach out to us. Jen, you have Hashimoto's disease. I don't even know what that means. How do I know when it's off? Okay, yeah. So Hashimoto's, your immune system is attacking your thyroid. It's like you have termites in your house. Okay? You just gotta make sure your immune system's happy so it doesn't want to attack your thyroid gland. And there's usually 8 to 10 different triggers that triggers your immune system to attack. You just gotta figure out what those are. Okay? And you can pretty much determine if it's off and a lot of times by your antibodies, by what your lab testing shows, and how you're feeling. Yeah. Thanks for following. Appreciate that. Jasmine is asking, what degree? Let me slow down. What degree do I have to do this? Okay, so a couple things is when I initially do this right now, I'm a licensed naturopathic doctor in Idaho. Okay, I'm also a certified functional medicine practitioner. Okay, I've spent thousands of hours of continued education to be able to do these. Again, remember, you probably weren't here, but when my wife had a problem, I flew all over the country. I spent $200,000. That's what I did. I did all of that stuff. Now, my initial doctorate, you can go to my bio, really was in chiropractic, but I never really did it. I did that for 4 years. I don't even do that now. I haven't done it for decades. One, my wife had the issue. Chiropractic didn't help it. Acupuncture didn't help it. Supplements didn't help it. Our conventional medicine doctors, our primary care didn't help it. Our endo didn't help it. The OB didn't help it. None of those people helped it. We had to figure out how to do it. And it did lead me to functional medicine. That's why now That's why I do mainly functional medicine, and I own a medical integrative clinic where we have medical providers in our clinic with us, and we work together. Okay, and really, they're there to really, if someone needs like some type of a prescription or something, then they typically they can do it, but our focus is natural medicine. Though. Eight some of the eight triggers. I'll give you some common triggers. In fact, what time is it? Okay, I gotta get rocking here. Um, eight triggers. You need blood triggers on point. Let me go right here. And listen, if you're struggling, guys, reach out to us. Right? We've helped 8,500 of you. You can get your life back. Here are some common triggers that you can have. Okay, slide this over just a little bit. Trigger. Triggers. Number one, blood sugar. If you're insulin resistant, you have ups and downs with your blood sugar, you're going to have an issue. Okay? You're going to have a definite issue. Okay. But you definitely have blood sugar. You got to get that on point. I recommend getting a continuous glucose monitor. You can get that in my bio, in my TikTok, because that is eye opening. That's a simple thing that you can do. It doesn't cost you a lot of money. And you can get a CGM and see what's happening to your blood sugar in the middle of the night, what's happening when you eat your food. Because if you have any complex chronic condition of any kind, fibromyalgia, Hashimoto's disease, MS, rheumatoid, Sjogren's disease, vitiligo, it doesn't matter. You need to make sure your blood sugar is on point. One of the biggest factors. Number two, gut issues. Okay. Common gut issues that we see. One of the probably number one, SIBO, small intestinal bacterial overgrowth. It's an infection in your small intestine. Number two, intestinal methanogen overgrowth. Okay. They just have different symptoms. SIBO causes diarrhea, uh, and intestinal methanogen overgrowth causes constipation. Okay, and they both have bloating. Okay, if you have one of those, you probably need a SIBO breath test. Right. We also see leaky gut. We also see H. pylori. And there's a lot of different gut issues that you can have. You need to look into those, see what's going on with your gut issue. Number three, toxins. Many chronic illnesses are from toxins and infections. Okay, toxins. Now, if you're having a sluggish liver, you may not be able to clear toxins. You may not also be able to clear your hormones. So toxins are a big factor. Okay, number four could be food sensitivities. Now, listen, I was one of those guys. Now, I've been doing this for 24 years, folks. I was one of those guys that used to make you do about 10 different tests, food sensitivities, all sorts of stuff, right? Listen, most food sensitivity tests are garbage. Sorry to say it, it is. There's only one lab that we use. It is Cyrex Labs that we use, but most of my clients, we don't do a food sensitivity test. There's a much better way to do it. It doesn't cost you anything to help with food sensitivity. Okay, but it could be food sensitivities. Some of the foods you need to stay away from if you have Hashimoto's and things. Gluten is a must. It's non-negotiable. Dairy, maybe, but dairy at least initially. Okay, soy and processed food. Food. Okay. There are some four common triggers that you can actually have, and you need to figure out which ones they are. You need to test for some of these things and be able to go to someone that knows how to deal with this. Okay. I just have done this for 24 years. I've seen thousands and thousands and thousands and thousands of people. Okay. Triggers. Now let's talk about some nutrients really quick. I'm just running out of time here. Let's talk about some nutrients. All right, nutrients. Number one, I'm going to go through a couple of these. Vitamin D. Okay. You need to get your vitamin D checked on your blood. That's what you need to do, folks. Get your vitamin D checked. It's vitamin D hydroxy. You want to get your vitamin D between 60 and 80 on your blood test. Because I know you're going to ask me, well, how much of vitamin D do I need to take? I don't know. What does your blood test say? Okay. But vitamin D with K2. And if you're wondering a good source of vitamin D, you can go to my bio, and I do have the supplements I recommend for my clients. Okay, vitamin D. Vitamin D helps your immune system not overreact. It's one of the things it does. Okay, that's when you have an autoimmune condition. That's part of the issue. Okay. Uh, Great. You scheduled a call. Happy. Can't wait to talk to you. Okay. All right. Next thing. Number two, selenium. All right. Now I know you're thinking about taking selenium. And how many in here are taking Brazil nuts? Give me a thumbs up or a yes, that's me. Or how many Brazil nuts you take per day? Okay. This is for selenium. All right. I don't recommend taking Brazil nuts. Okay. I don't recommend them. Now, it doesn't mean they're necessarily bad, but here's the problem when it comes to Brazil nuts. And I always want to go to food first. But the problem with the Brazil nut is your recommend for for selenium is 200 micrograms per day. The problem with the Brazil nut, some Brazil nuts have 40 micrograms. Other Brazil nuts have 400 micrograms. How do you know which one you have? You don't. That's the problem. And if you get too much selenium, okay, the problem that you're gonna run into is that can give you a big it'll make you feel worse than it does to make you feel better, okay? Selenium is important, but if you have too much of it, it's a problem. I'll explain that here in a second. The selenium, okay, I recommend supplementing that for that because we do have to be precise. Now what? Someone's I can't hear. Okay, so 200 micrograms. Now, when it comes to selenium, uh, the type of selenium you want to get is selenium methionine. Okay. Now, if you're wondering what to get the forms, if you go to my bio, I do have I have two different supplements for thyroid. One is for conversion. If you think you're not converting 4-3, that's a really good one for selenium and some of the major conversion. Okay. And there's also thyroid essential that gives you all the stuff you're going to need for your thyroid. A lot of people will get both of those. Okay. Okay. Now, selenium. Now, the next one, iodine. Okay. Should you take iodine or not take iodine? That's the key thing. What should you do? Okay. Iodine is important. You need to have iodine to make thyroid hormone. It's a must. However, getting too much iodine can be a problem. How much iodine do you need? Your body needs about 150 micrograms. Your thyroid needs about 130 micrograms of that. So before you take a thyroid supplement, what you need to do is do an inventory and see where you're getting your iodine from. Okay. Where are you getting your iodine from? Like some of your beauty products can have up to 2,000 micrograms. Okay, so iodine. It's really, really important. If you get too much, it's a major problem because it can be an issue. What is my opinion on the 150 microgram iodine RDI when Japan consumes 1,200 micrograms daily? Yeah, I don't have much to say on that one. All I can tell you is you're getting more than 130 micrograms, you're gonna cause problems. Now, what's going on over there? I don't know. Maybe DM me like the study or whatever you're referring to, and I can look at it. Okay. Let's see here. Got it. Okay. So iodine, that's where that's coming from. Now, next thing I want to talk about is glutathione. We want you to take glutathione. Now, here's the thing when it comes to glutathione. Okay, when you hear that your body, your immune system is destroying your thyroid gland, well, what's really happening is you have hydrogen peroxide in your follicular cells as part of the reaction to make thyroid hormone. Okay, and when your immune system is attacking your TPO, that helps basically neutralize that hydrogen peroxide, which is toxic. Okay. Well, glutathione is going to mop up the hydrogen peroxide left over and the stuff that's like spilled over. Okay. That's glutathione. Super important. And you will deplete your glutathione stores because it's made in your liver. Okay. Glutathione is really important. Okay. Now, Gina, if you're pregnant, I don't recommend you. Typically, you can be okay taking glutathione because it's made by your liver, but you'll need to consult your doctor on that one. Okay. Um, just check with your doctor what your OB if they want you to take that or not. Typically, I don't have people take that. I don't have my clients, but prenatal when they're pregnant most of the time. Okay. Now, Jesse, seaweed when it comes to iodine, I just saw that. I don't love doing iodine in seaweed either a lot of times because it's just all over the place. Okay. All right. Glutathione, really important. It helps prevent the damage in your thyroid gland. It also helps damage in your mitochondria that's making you energy. Okay, so glutathione. Now, here's the thing with glutathione. Many of you, if you're taking glutathione, you're taking reduced. You're taking reduced glutathione. Do not take reduced glutathione. That's what most products use is reduced glutathione. It's unstable. Reduced is the active form of glutathione, but it won't get into your cells. Okay? It barely gets into your serum. It'll kind of get in your serum, but it won't get in your cells. It won't make it. So look, if you're taking glutathione, look at your bottle. If it says reduced and that's all that's in there, you're taking crap. Now, the other form of glutathione that you want to do is S-acetyl. Acetyl. S-acetylglutathione. Okay? That's the form you do want to take is S-acetylglutathione. That is the form. They put this acetyl group on glutathione that helps preserve it to get through your gut and get through your bloodstream and actually get into your cells because that's where you want it. Third one here. NAC. NAC is a precursor. Okay. N-acetylcytosine is a precursor for glutathione production. Okay. And then last thing I know you're going to say, well, I'm taking a liposomal. Okay, liposomal form. Liposomal is not a form, it's a process. It's like a lipid layer around glutathione. Okay. Now, what should you do? Now, if you're looking for the glutathione that I recommend to my clients, you can go to the bio in my TikTok and it'll take you over where you can order it. Okay. But what it has is it has the S-acetyl is included in this. It also has the NAC and it is also liposomal. Okay. And there is some reduced in there too. So you get all of them. Best form. Like that's the one you want to go. Okay. If you're looking for glutathione. Those are some things that you can do to help reduce your reaction with Hashimoto's and help your thyroid function. Now, here's what I can tell you is if you're struggling, you just need to find out really what's going on. These things can help, but you really need a comprehensive approach to this. Okay? If you really want to get your life back. So if you're looking for that, you're ready to take action, you want to feel better, you can go to my TikTok profile, click the link there where it says more information. You can schedule a free discovery call. You can do my special for $179, $3,500 worth of lab tests, and an hour to 90-minute consultation with me via Zoom. Okay. If you do the special, okay, we will send you a lab order for LabCorp that you will do the draw in your state. You do need to be in the United States to do the special, but you can be anywhere in the world for us to help you if you, we just need to talk to you first. Okay. All right. I'll finish up here. How does D3 and selenium per day? Uh, D3 depends on your lab test. You need to get a lab test. Okay. Your doctor won't pull it. Go to my link. We can order it for you. Typically, I would start if you don't know what your lab is, 2,000 IU's a day of vitamin D. Selenium, it's 100. I'm sorry, 200 micrograms. Okay. Even before I took meds for hypo, I never had symptoms. That's great. Let's see here. Thanks for the roses. Appreciate that. You have active Hashimoto's, but I'm overactive now. That happens. Just you can go back and forth from Hashimoto's to hyperthyroid. Happens all the time. Yes, we can help people from Canada. Um, ugh, of course. Yeah, I'm not sure what that means, Jesse. I need this one done. Okay, great. I'm subclinical hypothyroid, bloating all the time, and anemic. God infusion. Will thyroid catch up? Wow, Sparkfly, you got a lot of stuff going on. Number one, why are you anemic? If it's iron deficiency anemia, well, why are you losing iron? Okay, it's probably not because you're heavy flow. There's something else going on. Blood, probably have SIBO. Okay, leaky gut. There's a lot of things you have to look into. Okay. Cost after treatment, it depends on what you're dealing with. I just don't know. Like I'll work with you maybe 4 to 6 months. Maybe you have something simple. We just give you a protocol and it's simple. Maybe it's more complex. I don't know, and it depends on how many additional tests you might need. That's why we do this low cost consult, so we know exactly what's going on. We'll be able to give you all those answers on that. Okay. Normal TSH 1 to 2. Uh, okay, good. All right, guys, I got to run here. I got a consult, but I wish you the best of luck, and hopefully we'll see you in the clinic or on our Zoom. Okay. You hear me okay? Hold on a second here. Let me get situated. You can hear me though?
Yes, sir.
All right. Sorry, I'm a little late today.
That's okay.
Let's see. I was actually, let me get this off. I need to cancel this.